In video 7, personal well-being was one of the 6 sectors researchers used to determine health in the Battle River Watershed study area. Under personal well-being, researchers used 3 different measures: personal physical health, chronic illness, and mental health. This video will explain chronic illness and the indicators researchers used to measure it, such as diabetes, chronic obstructive pulmonary disease or COPD, and hypertension. So why was chronic illness or conditions used as a measure of personal well-being? High rates of chronic illness or conditions can indicate poor levels of community health. Residents in the Watershed area could have barriers to access health care and treatment, and certain demographics of people may be at higher risk of developing certain chronic illness or conditions. Why did researchers choose to use diabetes, COPD, and hypertension? Chronic diseases are the leading cause of death and disability worldwide, according to the World Health Organization, and 4 of the most prominent chronic diseases are cardiovascular disease, cancer, COPD, and type 2 diabetes. Measuring chronic illness gives meaningful insight into the health of a population. So what did researchers uncover from the data regarding chronic illness or conditions in this area, and what does it tell us about health in the watershed, and how will this information help inform researchers about what should be done? The first map researchers created shows the prevalence of diabetes in the Battle River Watershed study area for 2019. Diabetes exists as either type 1 or type 2, and both involve inaction or reduced action of insulin. There's been an increase in the prevalence of diabetes in the recent years, including in the central region, which includes the Battle River Watershed area. The diabetes rate in the central zone is slightly lower or better than the Alberta average and slightly higher than the Canadian average. The second map researchers created shows the prevalence of COPD for 2019 in the study area. COPD is used to describe several progressive lung diseases, and it is incurable and characterized by breathlessness. The central zone, in which Battle River Watershed study area is located, has the second highest prevalence rate in Alberta, second only to the north zone and higher than the Alberta rate. There are also higher levels of smoking in the central area, which is a contributing factor. Third map or indicator for chronic illness or conditions show the prevalence of hypertension for 2019. Hypertension is high blood pressure, which increases the risk for heart disease and stroke and other conditions. The central area, where the Battle River Watershed study area is located, is close to the Alberta average but well above the national average for the prevalence of hypertension, and the rates have continued to increase since 2004. The prevalence of diabetes, COPD, and hypertension in the central area has been increasing. Cases of diabetes, COPD, and hypertension in Canada are low in comparison to similar countries, but there's still more we can do to reduce and effectively manage chronic illness and conditions. ECHO is an Environment Community Health Observatory network, so now that we've taken notice, how do we put this into action? The emphasis needs to focus on transitioning to a preventative model by using multi-sector, community-based approaches, which would address some of the accessibility challenges for rural and underserved communities. Another emphasis is to encourage local and provincial governments to implement more preventative policies that encourage healthy, active lifestyles and reduce household food insecurities.